Hi everyone, this is Sabrine with you, and we're having here Helal Ismail, our great speaker. Helal is basically a serial entrepreneur and technology leader who founded and scaled multiple tech companies from scratch to beyond $100 million exits in Silicon Valley and MENA region. He's currently leading technology for CAFU, the region's first petrol delivery and car ownership disruptor. Before that, he was the head of engineering for Careem's mass transportation venture. He managed to bootstrap and scale the business to operate in over 4 countries within a period of 6 months, taking over the majority of Uber's market share in mass transportation, ride sharing, and ride pooling in MENA. Helal founded Raptors.TECH, a Silicon Valley technology consultancy and digital ventures investment that had a portfolio of tech startups with 8 figures valuation. The firm was acquired along some of its portfolio companies for a total of valuation of $100 million in 2017. He always had a passion towards health tech. Hence, he founded and invested in some research and health tech companies in North and Latin America. He patented machine learning algorithms in the area of fatigue management and prediction. He led a team of data scientists that assisted scientists from CDC and WHO orchestrate a lockdown in Liberia during the West Africa Ebola outbreak in 2014 and 2015. Helal co-founded a retail and e-commerce startup in the US with profitability margin exceeding $10 million annually that was acquired for over $50 million. Thank you so much, Helal, for joining us. You have such an awesome bio, and we're so looking forward to your session. So Helal is gonna give us a session on using data science to predict potential outbreak clusters. So I guess that's gonna be super interesting, of course, for the audience from our hackathon.
Yeah. So thank you, Sabrine, for the introduction. I'll give you guys an overview about the topic that I would like to talk about today. It's basically how can we use fundamental data science. We're not gonna dig deeper into like tech specific or like running scripts or things like this. It's gonna be more of a high level overview. I'd like to cover 4 main areas in today's session. So the first one, I'd like to go over quickly how the world is fighting the COVID-19 outbreak currently. The second one, which is where does technology comes into this battle? And the third one is how fundamental data science can help in this battle. And the third one is what are the challenges that data science is facing in that battle. So first, let's start with how the world is fighting COVID-19. Well, basically, there are 3 different models that we can look at that has been, let's say, between successful or partially successful. So the whole point about fighting an outbreak of a contagious disease is not just having your number of infections set to 0. Well, this is an aspiration, of course, but coming from this background, I've been participating in the effort against the Ebola outbreak in West Africa back in 2015, and the number that we're trying to achieve is having an infection ratio that's less than 1. So if you guys have been reading articles about pandemics recently, or if that has brought some interest to you, there is this factor called the R0 or the RT factor, which is the infection ratio. As far as this number or this factor is more than 1, so this means that you're not controlling the disease yet. Because today you have 100 cases, and then tomorrow you're going to have 110, 150, and then it's going to keep increasing. And then at some point of time, your numbers will not become linearly increasing. It's going to become exponentially increasing. However, if your R0 is less than 1, so this means a single patient is infecting less than 1 patient. So this doesn't actually make sense. But what makes sense is 10 patients are infecting 5 patients, not infecting another 10 patients or another 20 and so on. So this means if today I have 10 patients and they are infecting 5, this means I have a total of 15, but I'm controlling, I managed to control those 10 quarantined or something, and then those 5 were not quarantined. And those 5 have infected 3. But then in time, I managed to control those 5 and quarantine them, and then I have 3 out there. And then those 3 will infect 2, and then I quarantine those 3, and then I have 2 out there. And then those 2 will infect 1, I quarantine the 2, I have 1 patient left. This patient, technically speaking, is not going to be infecting more patients. If I quarantine him, then I control the disease. So the whole point of fighting a pandemic is not to bring down your total number of patients to 0. No, it's to bring down your infection ratio to below 1. If we manage to do this means that we are on the right track to control the disease. Now, with that being said, we have 3 main models of fighting the pandemic. The first one is a complete lockdown, which is the China model. And this is a very aggressive, that's a very aggressive model that I don't think any other country will be able to impose it on their citizens. The whole point about China is such an integrated economy in a way that they can live with isolation. They are the factory of the world. They're not just an industrial economy, they are also an agriculture economy. They do have their own banking sectors, their own service sectors. It's a fully integrated ecosystem, fully integrated economy that can sustain on its own for a pretty long time. So with respect to that, that's a model that's very hard to challenge. That's a model that's very hard to be applied outside China. I cannot think of any other economy that's very integrated like China that can live in such an isolation. This is why most of the countries that have applied the lockdown were not able to achieve the same level of aggressiveness like China. So for example, we were under some partial lockdown here in the UAE. Egypt also has been under lockdown, and pretty much every single country in the region and in the world has been under lockdown. But if you look at the results, it's basically just slowing down the growth of the pandemic rather than controlling it entirely, because we are not able to apply such aggressive measures as China has done. The second model is basically mass testing, and this is where a country like the UAE is very successful at. So if you're looking at how many tests the UAE has done so far, and those are not the most up-to-date numbers, the UAE has done more than 1,200,000 tests till the moment, with a population of something like 9 million inhabitants. That sets the number towards something like 121,000 tests per 1 million people. This is a huge number. This is the UAE is by far, with respect to the percentage of tests to population, is the highest percentage in the world. So this means whenever you're doing that level of mass testing, you do have clarity and visibility on how the pandemic is moving, and you can take a few steps that can put you ahead of the curve. However, this is a very resource extensive approach with respect to either human resources doing that mass testing, or even the supply and equipment and the facilities and so on. The third model, which is basically most of the world is applying, is the detective work. And here I can look at 2 countries. I can give an example of Singapore and South Korea, and I can give another example of Egypt. So let's look at Singapore as an example. They're doing some extensive testing, not massive, something like 140,000 tests so far. But because it's a country with such a small population, this is covering something that's more than 20,000 tests per 1 million people, which is a very decent number, to be honest. Looking at Egypt, which is also doing the detective work, and we're going to come to what is the detective work moving forward. Egypt has done something like 100,000 tests so far, but because of the massive population of the country, from a percentage point of view, this is less than 1,000 tests per 1 million people. So if you look at the numbers in both countries, in Singapore, there are 17,000 reported cases so far, but the fatality ratio is very small. I don't remember the number, but I think it's around 20 people out of 17,000 cases, something like this. When you look at Egypt, we have almost 6,000 reported cases, but the fatalities have exceeded 300. And if you look at the numbers, it's there is something wrong in those numbers. And you can see that why a country that has 17,000 reported cases has such a low fatality rate, and another country that has 5,000 has such a high fatality rate. Because basically the numbers that we're looking at are the reported cases, not the actual infections, because of the capabilities of doing testing. And that takes us to detective work. So if you look at those two countries, Egypt and Singapore as an example, and even considering countries with higher capabilities with respect to resources like the UAE, what's common in all those models is basically the resource optimization. So what do I mean by resource optimization? In order to be able to detect those cases, well, you need PCR kits, you need capacity in the facilities, either emergency rooms or hospitals. You need medical staff. And if you're going to be admitting people to hospitals, then you need ventilators as well. So if you're looking at those resources, based on the strategic reserve for every country, it's the country's decision to either go and burn out those resources or try to save them. So most of the countries are looking at, well, this is my strategic reserve, and those will be my capabilities. So, for example, a very good example that we can look at, that's something that we always see in the news and in Facebook and so on, where someone gets tested positive for COVID-19, and then the medical staff refuse to test his family. And they ask them, just go home and quarantine yourself for 14 days. And then people go and complain over Facebook and so on, and we can see a lot of drama happening. And then people use this as to showcase the incompetency of the medical staff. In fact, this is the extreme opposite. If you are living in a country, like most of the countries that we have in our region here, that has such limited resources, either with respect to PCR kits or hospital capacity and ventilators, it's very unwise to go and burn out those resources for no reason. You should only be doing a PCR kit if you have a high probability of testing positive, not just burning out the PCR kit when you know that that might be a negative test. So whenever people go out and complain about medical staff not admitting them in hospitals or refusing to test them, to give them the PCR tests, I'm actually I look at how people look at those things, and how we as human beings, we judge by emotions, and then we try to find the logic to let's say validate our emotions. In fact, this should be the extreme opposite. So fear is an emotion, and people are driven by fear. And then they try to find the logic to say that, well, the medical staff in that facility, or that city, or that country are incompetent, or they don't care not to go and test people. While it's the extreme opposite. Those medical staff, they are trying to save the resources, the strategic resources, either in their hospital, in their city, or in their country. So that's just a clarification on how countries are fighting the pandemic. So again, we have three models: the complete lockdown, which is basically, let's say, impossible outside China, mass testing, and detective work. Then what is the detective work? It's basically, I have limited resources, and I would like only to consume my resources if I am sure that that patient has a high probability of being positive. Then this means detective work is basically the trace down. So you have a patient that's tested positive for COVID-19, and then we go and start tracing down where he has been recently, the people that he came in close contact with. And then we look at those people and we question them if they have symptoms and so on. And then if they do have, and then people start following up with them, like medical staff starts to follow up with them every like 2 days or 3 days. If they develop symptoms, then they go for testing. If they do not develop symptoms, then they don't go for this. This is basically the detective work. In fact, like 3 or 4 weeks ago, the Prime Minister of Singapore has been interviewed on CNN, and the interviewer was asking, how is your country very successful so far in flattening the curve? What are you doing differently? And he said, basically, we're doing field detective work. We're trying to save our resources. We're trying to be very cautious with our hospital capacity. Hence, we're doing detective work to only identify the cases that might be at either higher risk or higher probability of being positive. So this is on how countries are fighting COVID-19. Now, where does technology comes in? I'll be honest, this is where I see is the sad part. So I can identify 6 areas where technology, or 7 areas where technology are contributing to fighting the COVID-19. Well, obviously, the first part is finding the vaccine, which is pretty long term. The second one is different utilities or convenience or deliveries. So we started to see all the businesses out there moving to delivery, contactless delivery, and I can relate to a very successful model or successful business, which is Zomato. So Zomato, for example, they started sending communications to their customers saying that post COVID-19, you will have a contactless dining experience. So basically, you're using the app as if the app is the menu and the app is the waiter. The app takes your order, and then you're not contacting with anyone or with any of the restaurant staff. So this is basically around just convenient. This is, I look at the whole point of contactless services are more of a psychological relief to end users, but not definitely the ultimate solution. But yes, a good step, but not the solution. But that's one area out of 7 that I have identified. The third one is the tools that facilitates our day-to-day life, like conferencing. Like, for example, just imagine if coronavirus came 10 years ago. Pretty much we would not be able to have such a conference that we're having right now. I cannot think of anything that has been used massively for video conferencing 10 years ago other than Skype, and Skype has never been my best experience. The fourth area, which is a very important industry that started to rise specifically during the lockdown period, is the entertainment. So between content creation and gaming and so on, that's an industry that's also keeping people morally motivated. It's about I look at entertainment at this time. It's not just entertainment; it's more of also psychological relief. Uh, Fifth area is public awareness, and this is where technology was not very strong at. So if you look at how many hours you're spending on your phone every day, and how many apps you're using, and in fact, there are very few apps out there that started to communicate things like stay at home and stay safe and so on. That's with a message that's strong enough to push you, rather than a marketing message that's asking you to stay home and then we give you something. So in fact, the best experience that I can relate to here is Siri. So whenever you start a conversation with Siri recently, it has to tell you somewhere in the conversation that you should be staying at home for your safety. But other than this, I have not seen anything that's in fact urging people to stay at home for their safety rather than staying at home to sell them something. The sixth area is awareness, is alerting. So this is pretty much where everyone started looking at. So between Google, Facebook, governments of some countries like the UAE, like Singapore, like India, like Israel, uh, so many governments started building the alerting applications, and even individuals as well, which is all of them are using the same concept, the same model, crowdsourcing data and using Bluetooth and internet and pretty different wireless connectivity mechanisms to alert you if you came in contact with someone who has been tested positive. Okay, I don't believe in crowdsourced information in fighting a pandemic. I believe in opening legitimate data to the public and asking the public to find solutions, but I'm not expecting the public to be the data generator. This is if you're fighting a pandemic, you cannot find a pandemic if you are relying on just crowdsourced data or data that's not validated or justified. So that's one thing. Second, if you're trying to launch an app that's about Bluetooth alerting and things like this, and if you'd like this to be effective on a city scale, you will need at least 50% of the population to download the app. Not just download the app and actually use it and have their Bluetooth open 24/7 and have the internet open 24/7. Looking at the whole thing from the outside, this is a big joke. If you're trying to build a crowdsourcing Bluetooth awareness application, just to identify if you came in contact with someone or doing like location tracking of people and things like this, this is a joke. If you'd like to do that kind of tracing, well, there have been technologies from the 90s that we can use. So we can think of triangulation, basically. We can think of at any point of time, your phone is reading signal from different towers. Just by doing some basic mathematical triangulation, we can identify where are you, and by connecting this data to the database of positive cases, we can know when and how you came in contact with someone. This violates the people's privacy, of course, and this is a very invasive solution. But if you'd like to apply something on a country level, you are already giving away your privacy by using an application like Facebook. Facebook, every single app that you use login with Facebook, you're giving away a small bit of your privacy to Facebook. So if you would choose between your health and your privacy, pretty much people would go and choose their health. If we are in such a situation where tracking people is the most optimum solution. However, I don't see this as a solution anyway. But the point is, the approach where technology took, which is using Bluetooth and crowdsourced information, is a very wrong model even from the beginning. If you'd like to go and trace people, just do triangulation, basically. Well, this is on how technology has been fighting the coronavirus, and the last one, and this is the most unvisited one, which is prevention. So technology started looking at utilities, convenience, entertainment, alerting, awareness, and developing vaccine. But where does prevention comes in? As I said, every single country is trying to reduce the infection ratio. Well, how can I use technology to reduce the infection ratio? That's the question that we need to ask ourselves. So here comes the data science and the statistics part. So when I say fundamental data science, I'm not into like those jargon terms like let's go and use AI and machine learning and all those things. No, I would say just let's get back to the basics. Basics of statistics, basics of fundamental data science, which is basically around probability, mathematics, statistics, data plotting, data representation, data analysis, and so on. Look at a country like Egypt, for example. Look at the Ministry of Health, which is the frontliner for fighting the COVID-19. Just go over LinkedIn and see how many people work in the Ministry of Health in Egypt who does carry the title data analyst, not even the data scientist, just a data analyst. Zero. You have no data analysts working in the ministry. Well, how can you take data-driven decisions if you don't have a data analyst? If you're just relying on data that's on different pieces of paper. If you have done some research on, for example, how different quarantine hospitals in Egypt are collecting data and having a centralized repository of data. Well, it's the output is very sad. It's basically it's very manual work, and end of the day, every hospital is providing a report, and then there is someone who's manually putting that report together, and the announcements that the Ministry of Health in Egypt is making is in fact 1 day behind. So if we say that on May 1st, Egypt has reported 358 positive cases of COVID-19. Well, those cases has not been reported on May 1st. Pretty much they have been reported on April 29th, and then it has been validated on April 30th, and then communicated on May 1st. So because of the lack of data integrity, we take days to communicate valid data. So what about making decisions? Now coming to again to the point of data science, what can we think of? So I have 3 examples that I wanted to walk you guys through today. Well, the first one is planning quarantine hospitals and facilities. Just assume that if you have a map of the city, and on this map, you have the hospitals plotted, and you have the capacity in every hospital. I wouldn't even say being real-time updated, but you just understand the capacity of the hospital and how many ICU units they have, and how many ventilators they have, and the size of the medical staff, and how prepared the hospital is to host such a contagious disease. And if you have this plotted on a map, and you're using something like basic color coding, where you can say, okay, this hospital is hitting capacity limits, and we need to relieve the pressure on that hospital and move a few patients to another one, and so on. Just imagine such a decision to be honest, in our countries, in this region, it's very hard to take. The lack of data integrity is preventing us from taking such a decision. such a basic decision like how to plan the quarantine hospitals and the quarantine facilities. So I have prepared something that I would like to share with you guys. Let me share my desktop for a couple of minutes. Can you see my desktop?
Yes, we
Okay.
can see it.
So this is a map of Alexandria in Egypt, and all the green. Yes.
Hilal, it's I think it's your other screen. It's CAFU car or something.
Okay. Okay. Hold on. Let me re-share my screen.
Yes.
Okay, can you see it now?
Yes, perfect.
Okay. Yeah, so this is a map of Alexandria. The green dots are basically hospitals, between public hospitals and private hospitals with massive capacity and the military hospitals. The ones that has a red blinking are basically hospitals that are currently quarantining COVID-19 cases. And the one that has that less blink, the orange blinking, those are the next hospitals to be considered if those hospitals hit capacity limits. So if you're looking at the map, just trying to validate the decision. Basically, this is the city of Alexandria, and the two hospitals that are being used for quarantines are outside the city. So one is on the extreme east, and one is on the extreme west. And you can see that most of the hospitals are here, this is basically where the city is, and those are the outskirts of Alexandria. So the decision was basically made to quarantine because of the nature of the disease. We need to quarantine people outside the city. Well, that was not properly planned because no one thought that this is going to last for long, and this is not a disease that will come for like 2-3 months and then go away. In fact, we have been dealing with it for the past 6 months so far. So just picking picking a criteria of choosing a city, of choosing the hospital outside the city to quarantine people was not the right approach, to be honest. And those two hospitals that they have been picked, they only have been picked because of the geography, not because how prepared they are. And then the three other hospitals that have been picked, a totally different criteria. They have been picked based on their capacity. So the biggest three hospitals, which is one is a military hospital, and the other two are public hospitals, and they have been picked because of their capacity. But if you look, for example, where are the most of my cases located? This should be where the hospital is, because, well, basically we need to think of logistics. We need to think of if the most of the cases that I have are on this area, then it makes sense to have my hospital closer to or just outside the infected cluster, so that I reduce the friction. I reduce the number of kilometers driven with a positive case. I reduce the travel time, let's say, of their families and things like this. So people usually they go to the hospital to ask about their relatives and so on. Yes, they're not allowed to go to the quarantine facilities, but you cannot prevent them from going to the hospital and just trying to ask and talk to the staff. So you're giving people more exposure, and you're forcing people to move more in and out the city. Maybe they just go outside and bring the disease and get back. rather than just trying to contain the disease from the area it started from. So that's one approach that I've been thinking of. The second one, if you can look at that red route that I have, this is in fact this is a valid data about a patient that was reported positive. He was working in a hospital in Alexandria, and basically, pretty much this is the hospital. Um, sorry, this is the hospital that he has been working on, and he was working in a hospital and in a testing lab, and he has moved in the 3 days before testing positive on that red route. So just imagine, this is basic detective work that I managed to crowdsource from some of my connections who work in one of the quarantine hospitals. Just imagine if we have that data plotted on a map for every single case, and this is very easy to collect. This is basically how Singapore is doing things right now. So for every positive case, we do that detective work, and we basically can plot a map for the movement of every single patient on the 2 or 3 days before he's been testing positive, or the 1 week before he has been tested positive. Just assume that if we do have this information, that can help us in two things. Regardless of the first case that I discussed, which is planning the capacity and the quarantine facilities, every single country right now is running a disinfection program. Assume that if you can plot a heat map on the main roads that we have, based on the positive cases that have used those main roads, we can focus our efforts with respect to disinfecting those main roads based on data. So we can say that, for example, this is Alexandria's Corniche. This is the beach road. Most probably, if we plotted the data, you will have the most of the people using this road. But what if, well, for any reason, most of the cases are on one of those clusters, and this road is the road that has been used by most of the cases, then we should focus our disinfection efforts on this road, not on the main one. Right now, we're doing disinfection based on gut feeling, not based on data. So this is the second application that we can use. I wouldn't even call it data science. I would call it fundamental statistics for. And the third case is that we can the third case that we can think of is how can we quarantine a city. So basically, this is a very pessimistic and aggressive approach, but I have been exposed to this back in 2015. Well, I was working. That was my own startup. We were doing a business with some of the mining sites, and then we got exposed to the Ebola outbreak. And this is a very underserved country with respect to infrastructure, medical staff, and so on. So they had the data scientists coming from the US, from the CDC, to control the infection. I had the team on the ground at this point of time, so we volunteered and we joined forces with the CDC, and we helped them in orchestrating the lockdown. So basically, it's very hard to orchestrate a lockdown on an entire city unless you're China, but it's relatively easier to lock down a neighborhood or an area or some parts of a city. But in order to do so, well, you will need to have information about how, if this is a cluster, how a cluster is being developed, and you can predict a cluster before it's even developed. So moving back to this route, just assume that this person moving like this, plotted for or 400. And we can see the intersections, and we can see things like the destinations that they are going to, the bus stations, what areas does those bus stations go to, and so on. We can come up with two things. We can come up first with data that are considered the destinations where those people has spent a lot of time to be a potential cluster with a higher probability. And we can look at something like the destinations from the bus stations that those guys have used, or the metro stations, or whatever. And there is another probability where the positive case has contracted with someone in that bus station, and then that guy or that lady has took the disease to the destination that he's going to. So we can look at the destinations from, we call them the forking routes, from the forking routes of positive cases as potential clusters of diseases, but with lower probability. So what this gives us, it gives us, first thing, you can identify that, for example, this area can be a potential cluster. So I can start preparing the logistics and the resources. I can be 2 or 3 days ahead of 2 or 3 days ahead of announcing that this area is a cluster. So pretty much, we know that this is a disease that takes that has an incubation period that's pretty long. So if you are able to identify, well, there is a huge probability that this area is going to become a cluster for the disease in 3 or 4 days from now. I can start preparing my logistics. I can start preparing like food and the closing roads and things like this before announcing a cluster in that area, and I can orchestrate a lockdown in a few hours rather than just having chaos in orchestrating lockdowns. So that has been an approach that we have used in a very underdeveloped country like Liberia. Now, looking at the capabilities of the countries that we have in our region, we are, I would say, from a logistics point of view and from a resources point of view, very prepared to do such a thing. Then what's preventing us from doing this? What are the challenges that we have? We basically have two challenges. We have a talent challenge and we have a data openness challenge. So data openness, let's say, for example, I would like to do an analysis on Alexandria or about Dubai or Cairo or any city in the region. Where can I find data? I cannot find it anywhere. Data is not open for public, and even the data that's open for public, it's very high level that cannot be used to run an analysis. So pretty much, what do I need to run an analysis? Well, I need not just the number of cases detected in a city, I need the number of cases, and I need to know where they have been tested positive, where do they work, where do they live, what are the areas that they usually go to. And then I can run some modeling that can predict routes with different levels of probability, and I can feed it into that model and then come up with different data. So data openness is the first challenge, and then talent is the second one. So although that we live in a region that has some massive human resources, one of the biggest challenges that we're facing is an area such as data science and data analytics is very very early with respect to development in our region. So again, let's not look at countries like, for example, the UAE and Saudi Arabia, where they are bringing talent from outside their mainland. But let's look at other countries like Egypt, Sudan, Morocco, Algeria, and so on. Countries that has good education, relatively good education, but this is an area that does not have, let's say, industrial or did not have industrial applications on field. And if you decided to pick this as a career, pretty much it's going to be so hard for you to find something in your home country. So people are walking away from such a career. So that leads to two things. I can relate to a few examples here. The first one is the Ministry of Health example in Egypt. Just look at LinkedIn. How many people work in the Ministry of Health, which is the main frontliner, as a data analyst or the data scientist? Zero. How many people work in any Ministry of Health, let's say in North Africa, or a data analyst or data scientist? I'm pretty sure that you will find just a handful of people. The number is not going to be even two figures. And the second example that I can relate to is multinationals. So look at most of the multinationals who are working in our region. I'll give you a very sad example about pharmaceutical companies. So countries like Egypt, Saudi Arabia, Jordan are big producers of medicine and pharmaceuticals. And those are basically multinationals who have the license to manufacture in those countries. But the headquarters is somewhere in Europe or the United States. We have the business intelligence or the data analysis or the data science functions of those multinationals, not in our countries, not in the region. So for example, we have some really big pharmaceutical manufacturers in Egypt, and those countries, with respect to, for example, how good they are performing in sales, the data does not come from the Egypt team. The data is being collected, analyzed, processed by the HQ team in Italy, in Germany, in the United States, and so on. So if you're willing to take a data analysis as a career, unless you're working in an industry like transportation, logistics, and so on, which started to rise in our region, it's very hard to find a proper job in any other sector or in any other industry. So this is, at least for the past few years, has not been that attractive field for people to go into, which has led to a situation that you're looking at. Just go to any open data sets website, or go to Kaggle and look at how many people, how many data sets out there, how many people are developing some models or scripts or small programs based on those data sets, and how many people are doing this who are coming from this region. You will be shocked by the numbers. It's a fraction of a percentage, and most of the numbers are coming either from Europe, the United States, China, India, and so on. So again, let's not look at countries like the UAE as model. The UAE is pretty much an exception. But looking at other countries in North Africa and so on, which is this is where the majority of the population of the region is coming from. This is where those this talent or this industry is very unattractive to young individuals to look at, which has caused the situation that we're in right now. We have a lot of data. We have the human element to fight such a disease, but we don't have people who are capable of going and taking decisions. And if basically you have someone, or you have some entity or a company or an organization who can go to the government of a country and say that, well, I would like to help you with that battle with COVID-19 and give you 1, 2, 3, 4, 5, but I need from you 1, 2, 3, 4, 5. Unless you do have the right team in place who can do this, you will not. Your country will never be interested. I'll give a counter example. Here in the UAE, we have been in my company, my data science team have been doing some analysis on the side for COVID-19 and how can we prevent it, and we have been developing some models internally at CAFU. We got in contact with many government entities in the UAE, and the output has been very positive and very promising because of the data integrity that the country has, and because of the availability of the talent on field. But now looking at other examples like North Africa, how can we jump into those countries? How can we help those countries? We do have a major problem with respect to data analysis and data science being looked at as not an attractive career in some countries in the region. And we do also have other challenges with respect to data integrity, which is, to be honest, the less important challenge. If you do have data and you don't have people to operate that data, you will never do anything out of it. Well, this is pretty much everything that I had for you guys today. I hope you enjoyed it. I would like to get some of your questions. And now, Sabrine, the stage is all yours.
Perfect. Thank you so much, Hilal. It was super insightful. Thank you so much. I guess we have already one question that's been asked a while ago from Elise. How is flattening the curve a solution? If you do some math, 90 million, 1.6 million need special care. If you have 2,000 medical beds for a week, then 1.6 over 0.002, 800 a week in perfect conditions for the curve to start decreasing without passing healthcare system capacity.
Okay. Let me answer this. Flattening the curve is not the only solution. As I said, it's a combination of three things. Flattening the curve is just giving your medical system room to breathe. The real solution is decreasing the RT or the R0, which is the infection rate. This is the solution of fighting the pandemic. And the third area is optimizing the resources. So let's say if you have 1.6 million people who need special care, in fact, the example that you're giving me, your 1.6 million people will not come immediately. If you're trying to flatten the curve, they will come over time. And I'll tell you one thing: if you do have, let's say, 2,000 people who need medical care every week, just by doing the math, let's say this means you have 300 people who need a bed every day. In fact, the numbers, the math is not right. So if you have 300 patients coming to you every day, in fact, this is a very good number. This is not a bad number. And 1.6 million people over 800 weeks, this is for anyone who's operating a medical system, this is music to his ears. If you're gonna come to me with the 300 patients every day for the next 800 weeks, and regardless of the economical impact, this is a very good numbers for any any healthcare provider or any health system. However, the point is, this critical figure, this resource that you're talking about here is basically the number of beds that you have. I'll tell you how, let's say the UAE and Egypt and most of the countries are looking at things right now. Not every positive case is admitted to a hospital. So most of the countries in the region and in the world have started looking at first self-quarantining even for positive cases, and the second, quarantining in some non-medical facilities like hotels and so on, and third is being admitted to the hospital. So the governments right now are trying to deal with the number of beds as the critical resource, not just the number of ventilators. So it became the number of beds right now. So Egypt just announced it yesterday that they will not be admitting all positive cases to the quarantine hospitals. They will be using hotels. They will be using even your home. You can be quarantined in your home. I hope I answered this properly.
Perfect. Okay, we have other questions from Osama first. What are the parameters used for clustering analysis in Alexandria and during Ebola virus in Liberia?
Okay, I cannot answer the one in Alexandria because this is, let's say, what I've been showing you is a very naive analysis. I need more data to come up with analysis, but I can answer with respect to the Ebola. We basically have been looking at the geography. Uh, the parameters are for every patient, where does he live, where he was reported or where he has started to show the first symptoms, and where does he work, and the number of people that he came in contact with, and the routes that he's using every day. However, there is a major difference between Ebola and coronavirus. Coronavirus has an incubation period between 2 to 14 days. Ebola has an incubation period, I think, between 1, 2 to 5 days. So, plus coronavirus has very different symptoms from one person to the other. Ebola is a very aggressive disease. It delivers symptoms very fast and very tough. So it's very easy, although that this is a sad scenario for the patients. In fact, a disease that's more that has a higher fatality rate and the more aggressive symptoms like Ebola is easier for healthcare providers to deal with because you can easily identify the patient, you can easily isolate them and identify whoever came in contact with them. Because of the short incubation period, it was, although that the Ebola was way more deadly than Corona, Ebola has a fatality rate of 50%. Out of every 2 people get the disease, one dies. But it was easier to control it because of the disease is more visual than the coronavirus.
Mm. Great. Okay, that's very interesting. Okay, then we have Anonymous asking, how do you get more companies to share their data regarding travel of their people? Analysis is one level of challenge. Good data sources are a bigger challenge.
Okay, again, I'm not an advocate for crowdsourced data. I'm not interested to acquire data that relates to people's privacy if they are not tested positive. However, if you have someone who is tested positive and you would like to do that level of analysis to identify the potential contacts and so on, you should do this with the person himself or herself. You should not go to their companies and ask them to share data and so on. Unless you feel that there is some lack of information that you're missing, then it's more of a detective work. But just sharing data for the sake of sharing data, this will take you nowhere.
Okay. Okay. Then we have another question. How can we get more governments with shared borders to coordinate their efforts, especially following opening and minimizing second phase occurrences?
Well, I'll tell you one thing. What do you mean about shared borders and coordination? So this is, let's say, this is countries with shared borders. This is a very old school approach. So let's say right now, apart from the GCC, where you can easily travel with your car across 5, 6 different countries, technically speaking, you have shared borders with every country in the world. So you can take a flight to Egypt. That's I don't know how many kilometers away, but definitely not closer to you than Saudi Arabia from the UAE, for example. And you can arrive to Egypt faster than driving to Saudi Arabia. So technically speaking, you have a shared border with every single country in the world. However, I'll tell you one thing. In fact, one of the reasons one of the things that the World Health Organization was pushing for is people traveling, not people not traveling. And the main reason is if you're crossing borders from one country to the other, you get tested, you get a mandatory test rather than just carrying the disease and staying in your home country. So in fact, traveling can help the healthcare providers identify the disease faster. However, the challenge that we're dealing with here is the long incubation period. So if you're dealing with a disease that has a shorter incubation period, any healthcare provider would push people to travel and just have a proper check on the borders, in the airports or whatever the border can be. However, the only challenge that we have with coronavirus is incubation. But answering your question, I think this will happen by default. But if we're talking about how the public can contribute to this, I'm pretty sure that governments are trying to do whatever they can do to get the borders open and to make sure that a second wave will not happen. But it will happen eventually. But when it happens, should not be as strong as the first wave. But I think the answer should not come only from the governments. The answer should come from the public.
Okay, perfect. عمار is asking يعني هناخد السؤال ده بالعربي. أيهم أهم الاستثمار في الجانب الوقائي أم الجانب العلاجي؟ عدد المصابين أقل بكثير من عدد من يجب عليهم أن يتوقوا الوباء، لذلك نرى أن الاستثمار في المواد الوقائية سيكون أنفع في الاستثمار حتى على المستوى البعيد. والمواد الوقائية قد تكون في الجانب المعماري، تصميم وبيع كبسولات نقية يسكن وينام فيها الإنسان للوقاية من الوباء. فهل تعتقد أنه سيكون لدى كبسولات الوقاية مثل هذه مستقبلا ناجحا في الاستثمار؟
Okay, you want me to answer in Arabic or in English?
I guess Amir understands English, so let's.
Okay, so let's repeat the question in in English. So the question is about investment. Should people invest in preventives or in finding more of a cure? And he is more of an advocate towards investing in preventives, like sleep capsules that can prevent people from getting the disease and so on. So I'll tell you my input here. It's I'm not going to go this far. The example that you're giving, which is sleep capsules that can people live inside and sleep inside, that can prevent them from the disease and all those things. This is a very apocalyptic view, I would say. However, that disease will change how we live our lives. Let's just say 3-4 months ago, if you saw people, if someone would tell you that you will go to the street and you will see everyone wearing face masks, you will laugh at them. You will say that no, this is a joke, you know. But now this has become the norm. So just walking in the street, putting face masks, gloves, and all those things, that has become the normal recently. However, I believe that anyway, a cure will come and the vaccine will come, just a matter of time. But even after finding a cure, finding a vaccine, life as we know it have changed. And this is an inevitable change. So it's going to be more of changing habits and changing the way we do things, rather than having a very apocalyptic vision of the world and try to come up with things that are extremely preventive that has not been there. Just remember, we're human beings. After we pass this whole thing, just after we pass it with a few weeks, we will forget it. So. And investors look at not just short term, they look short term, medium, long term, and so on. So I would say, considering that the world has partially been successful in dealing with that disease so far, I think it's going to be more of people investing in the cure, and people are investing in how habits will be changed, and how companies can cope up with the change of habits, rather than coming up with more of apocalyptic products.
Yeah. Okay. We have another question. What can we do to encourage healthcare systems to share more data about patients?
Well, that's actually a very good question. I think one of the things that that should happen is having an open data program. So there are some countries in the world that does have an open data program. The UAE is one of them, but it's not that integrated. I would call this supply demand. Why should I invest effort and money in having an open data program if there is no one using it? So unless someone starts to use that open data, there will be no demand to drive having your data open. So I think talent should come first, and then data openness. If you have more companies and more individuals trying to take initiatives with respect to finding solutions that are data driven to the COVID-19, and they do need data from healthcare providers or from governments to get that solution to be into reality, uh, governments and healthcare providers will not have an option but to commit to that. It's just a supply demand. There's no demand. Why should I create a supply?
Okay, perfect. So we have a question from Rahul. How do you think technology can help in country like India with a population around 1.35 billion, where technology internet has not touched a major part of the country? Although there's a complete lockdown since March 24th, and so far the data look better as compared to many technology-wise advanced countries.
Yeah, well, I have a few points here. First, I think the question should be how how do you think technology can help India? No, I think how India can help the world. This is the right question. Uh, India has the highest number of technology-related, let's say, technology-related workers. Have one of the highest numbers of startups, maybe just right after the United States, if not even higher. In fact, I've been reading so many articles and so many research papers that are predicting that the cure and the vaccine of coronavirus will come from India. I think with respect to having the lockdown and data looking better than so many other technology advanced countries, this is more of a geography driven. India is a huge country, not just huge population and huge space as well. So maybe in some country, in some cities, they are overcrowded and overpopulated, but in some other cities, if you look at how the population of India is sparse across the nation, it's compared to, let's say, a country like Egypt. So Egypt have 100 more than 100 million people, but they occupy 3% of the space of Egypt. Compared to India, I think the number is way higher. I think in India, people occupy more than 40% of the mainland. So geography is one of the things that's helping to drive the numbers to become better. But with respect to how technology can help India, I would say India and any other country. It's basically I believe that the data integrity is the right answer. So again, India has launched one of the Bluetooth apps that can do the patient tracking and all those things, and the penetration has been 50 million downloads. 50 million downloads out of 1.3 billion people. That's a very low figure. Even if it says 50 million, 50 million across the nation is nothing. So I think changing the concept from relying on crowdsourced data to relying on legitimate data that does already exist on the healthcare providers, and that's one thing. The second is data integrity and having this data open to talent that can come and build solutions. So one of the most favorite examples that I would like to use is Kaggle. So Kaggle is an open data sets platform. Just imagine if governments decided to expose some of their data on Kaggle, and then this is open to the world to go and use that data to solve problems. Imagine how many countries will benefit from this? And the last thing that I would add here, fighting the coronavirus outbreak should not be on a country level. It should start from a way smaller scale. It should start from a neighborhood or from a city level. So if you do have this is how in 2015 we managed to control Ebola in West Africa. We were fighting the disease not on a city on a nation scale. We are in fact fighting it first on a city by city and then on neighborhood by neighborhood. So we managed to isolate different neighborhoods and then fight the disease on every neighborhood individually. And then that was like a domino effect across the nation. I think what we're trying to do, or what the entire world is trying to do, is the extreme opposite. They're trying to take a top-down approach, while the right approach for this is more of a bottom-up approach.
Okay, yeah. And we have Ahmad saying, in the oil industry, we can find how supercomputers predict the location of oil accurately, that have millions of parameters and equations, but until now, we can't see this power in solving real health issue like a virus or find a vaccine. Do you think that we are not utilizing the tech correctly, or how far are we from utilizing this power?
No, I feel that, forget the tech, supercomputers and all those things right now on the side. I've been in the tech industry for the past 15 years, and I don't believe in this jargon. I believe in fundamentals. So forget the fancy stuff. We are missing the fundamentals. We are missing data integrity, and we are missing the talent that can operate this that data, and we are missing the fundamental science that we can go and apply. So basically, if you do have the right data in place, and you do have someone who got the right skills, so that he can operate that data correct, and you don't need anything basically other than just the right data and someone skilled and a pretty old laptop to go and analyze this data. You don't need supercomputers and all those things. You just need to have your data to be validated. You need to have the right science in place, and that's it. I don't think I'm not a big fan of things like supercomputers and AI and all that jargon. I'm a very realistic person, and I believe that what we are missing is the fundamentals, not what tech can give you. Tech is just a tool.
Great. I think Raul is following up on his previous question. So, Raul, if you could just rewrite again why he's saying, so why countries like USA have not been able to do it? I guess he was referring to comparison with India.
Yeah.
Right.
So I'll tell you one thing. So well, in the US, that's a totally different story. You will need to understand how the geography on the ground for the US is, and how people move there. I have lived in the US for 11 years. So in the United States, let's say I'm just going to compare it to Egypt, for example. In Egypt, if you live in, let's say, Alexandria, how many times you would need to go from Alexandria to Cairo in a year? Maybe 2 or 3 times. But in the US, it's totally different. Let's say if you live in New York, New York is a huge state. Maybe not with respect to geography, but at least with respect to population. Let's say I lived in New York for quite some time. How many times I had to move from New York to New Jersey to Massachusetts and so on? A lot. Transportation in the United States is a huge industry, and intercity transportation is a huge industry, and you have so many people commuting from one place to the other. That's one thing. Second, as far as I know, the US has relied on some fake data, and was one of the last countries to close their borders. So they closed their borders pretty much I think 3 weeks behind everyone else closing their borders. So that has the damage, has caused a lot of damage to them. And the US is having a federal government and state level governments. And if you're following the news, you will see that those two entities are not always in alignment with each other. So yes, in fact, I'll tell you one thing. The US, they do have one of the highest numbers of, or in fact, they do have the highest number of both fatalities and reported cases in the world. But they just have two crisis cities, New York and one other state. I don't remember. I don't remember it. But other than this, that's a huge nation with 50 states or 51 states, with 48 or 49 doing a pretty good job, and two crisis zones. Well, and New York, the thing is, New York is pretty much the same. It's a global hub, just like Dubai, but multiply it 10 times. And imagine if Dubai did not shut down in early March, and Dubai like shut down 3 or 4 weeks ago, like flights, blah, blah, blah. So a small city, a relatively small city compared to New York, like Dubai, they started to have their measures early enough. New York started to have their measures very, very late, and they started to fight to have the COVID-19 response when the situation was already exploded. So pretty much acting fast was the missing factor in the US case.
Perfect. Okay. So anyone else, guys, has any questions? I guess we've passed the hour mark anyways. It's been a very interactive session with all the questions you asked. Thank you, guys, and thank you so much, Hilal.
Thanks, Sabri.
Thank you. It's been awesome. Okay, so I guess I'm gonna conclude it now. Thank you, everyone, those who attended. Thank you for your questions, and see you again soon. We have a webinar also tomorrow, by the way. I'm gonna announce it very soon. And we have another webinar in a couple of days on agile development. So for those of you who are interested, please join. Thank you. Bye-bye.
Thanks. Bye.
Thank you. Bye. Bye.
Thanks.